We are talking about new long COVID research and what you should know about it. Joining us live this morning is Dr. Kiko Iwasaki, Sterling Professor at Yale School of Medicine and Director of the Center for Infection and Immunity. Good morning. Thank you for your time.
Thank you for having me.
Of course, people have heard of long COVID. Obviously, people have talked about long COVID. You know, it's really been a topic of concern since the pandemic. But now I understand that there are new findings when it comes to long COVID. What have you found?
So our study found that some patients with long COVID develop immune responses that mistakenly target their own tissues, including the nervous system. So in particular, we identified elevated levels of autoantibodies that can interfere with normal neurological functions. So these immune changes were associated with persistent symptoms such as chronic pain. And not all patients had these autoantibodies. And these findings reinforce the idea that long COVID is not a single condition, but may involve distinct biological subtypes.
Very interesting. And I have to ask, when we hear of antibodies, sometimes I think we associate antibodies to a good thing. You were talking about autoantibodies here. What is the difference here, and why and how do autoantibodies make you sick?
That's correct. So antibodies are proteins made by the immune system that are supposed to fight off infections. But in this case, they mistakenly target our own body's cells. So when that happens, when they bind to tissues, they can disrupt normal function or cause damage. For example, if they target components of the nervous system, they may interfere with signaling in the brain or the peripheral nerves. And this can lead to symptoms like cognitive difficulties or pain. So in essence, the immune system becomes misdirected and contributing to ongoing illness even after the virus is gone.
Very interesting. And I have to ask, is this really concerning? Because obviously you cannot necessarily prevent if you get long COVID.
That's correct. But our findings really point away towards potentially coming up with targeted therapies that would reduce these autoantibodies to improve patients' health.
Very interesting. And let's talk more about implications that your study has or may have on future treatments.
Yes, so our findings really open the door to targeted approaches and new diagnostics and treatment for long COVID, particularly for patients that have these autoantibody features. So therapies that reduce these harmful antibodies or modulate the immune system may be beneficial for this group. It also highlights the importance of identifying biomarkers to match patients with the treatments most likely to help them. So in the future, we really need to test these hypotheses using clinical trials.
Absolutely. Very interesting. Dr. Iwasaki, thank you so much for your time.